Welcome to the EAU podcast. At the Turin Oncology Prostate Cancer Masterclass, UROONCO Prostate Cancer Chief Editor Dr. Marra talks to Professor Rocco on the new robotic technologies in prostate cancer.
Dear friends and colleagues, we are here from the top masterclass in Torino with Professor Bernardo Rocco, who's Chief of Urology at Gemelli Hospital in Rome. Today he gave a lecture about new technologies in prostate cancer that can be used to treat locally advanced disease in prostate cancer. The talk described several new technologies and from augmented reality to new technology to predict complications, to new robots, up to telehealth. So can you give us a brief overview stating the main topics of your talk?
Thank you very much. So we can say that robotic, of course, is the actual reality, but it's also the future. And there are several things around robotics that are assisting us in doing our job in a safer way with better precision. So I would say that there is a lot around imaging and 3D reconstructions that should allow us to become more proficient. Augmented reality, metaverse can be of help. And furthermore, several other technologies like confocal microscopy can be useful to understand if the resection plan was appropriate or not. But I think that the major interest and more recent is the concept of telesurgery. That means that the surgeon is in one venue, whereas the patient is far away, among 200 or 300 kilometers up to 13,000 as an example. And this could really help to imagine a new way to do surgery in, I would say, in also a democratization of the surgical technology that can reach even areas that usually are not considered for that.
Okay, thank you. It's very, very interesting that you picked up telesurgery amongst all the different technologies. So, more specifically, what do you think can be the direct impact in prostate cancer surgery? And you also mentioned telesurgery can impact training of new surgeons. How do you think this can practically impact training?
Well, we can say that since from an epidemiological point of view, prostate cancer is very common, this could be the better environment where telesurgery can become more popular. This is something that in China is already a reality. Several cases have been done so far. And there is a request of major surgeons being connected with remote areas to perform their surgeries, particularly prostate cancer, particularly prostatectomy. And this, is something that is already happening. But in my vision, training is one of the keys. Because we can imagine that someone who has been exposed to major experts doing surgeries that come back home and has to start his cases, he might have a mentor, he might have a preceptor going home, assisting him from the first cases. But you can imagine how it can be different if you can go ahead with other cases. And in case of difficulties, you can ask assistance from remote and having an expert taking over the most difficult part of the surgery. This can be very much helpful, I think.
Yes, so you don't need your mentor to be next to you, but your mentor can be on the other side of the world or simply in his office. That's already a starting point. And another point, I think it could be in certain countries we cannot operate on cadaveric models, whereas if you are going to start with cadaveric models, you could virtually train in your country, having cadaveric model in countries where this is possible. And a last quote is something that is not very or 100% medical, but it would be important for us, given the growth that you just said you predict in terms of telesurgery. What is your thoughts on regulatory aspect of telesurgery?
Everything has to be built in this environment. There are a lot of things that are already moving, like United States FDA. They're going to have to see what happens in Europe with CE mark. From a medical legal point, it's hard to understand how this can be developed, but we are working with some experts to try to figure out how can be the best way to do. Everything has been run by Vip Patel starting from February 2024 at the SRS meeting that was held in Orlando with all the stakeholders involved to try to understand how can be the best way to do with that. So there is a lot to discuss about the surgery, a lot to discuss about who is responsible, what happens after the surgery, the postoperative care, who is responsible, what happens to the patients once I have operated on him and I'm at home, and then he has issues that has to be managed in a remote country by remote assistance. So there are many things to figure out. Also, if there is a mechanical failure of the system, we really have to understand how this can be managed, also for the telecommunication part. But strange but true, it seems that this, according to the Chinese experience, is, I would say, the minor issue. The telecommunication seems pretty stable.
Okay, thank you very much. So a lot of things have already been done, impressively, I would say, also in terms of latency and practical aspects, but we also have non-practical aspects that we will need to deal with. Very interesting talk today again, and very interesting to discuss about the future of prostate cancer surgery/telesurgery. I would say thank you, Professor Rocco, for being with us.
Thank you for listening to this episode of EAU Podcast. To keep up to date with prostate cancer developments, visit our educational platform, UROONCO Prostate Cancer. For more EAU podcasts, please go to your podcast app and subscribe to our EAU podcast channel for regular updates.